iGlaucoma presents a video series with editorially independent content supported with advertising. Do you recognize problems with compliance when it comes to prescribing medications for patients with glaucoma? Do you feel like you may be missing opportunities to help patients do better with their drops? Would you like to know some strategies on how to improve compliance with glaucoma medications in your patients? If so, keep watching, because what you're about to hear, learn, or be reminded of may be the answer to saving someone's vision. Also included in today's video is access to a free must-know guide for your glaucoma patients and some great news, so stay tuned to the end to learn more. Hello, and welcome to the iGlaucoma YouTube channel. My name is Dr. Constance Okeke, creator of MIGS Meds University, where we talk about the new, the old, the current, and pipeline medications that are used for treating glaucoma patients, as well as different medical management strategies for active implementation. If you missed the previous video where we went through the first 3 key strategies to help improve compliance with the medications for glaucoma patients, check it out in the description box below or in the card in the upper right hand of this window. So, let's dive into what we want to talk about today, which are more key strategies starting with step number 4. Educate the patient. One of the things that is most important in educating is making sure our dialogue matches what we are meaning to say to the patient. If we talk about glaucoma in simplified terms, such as high pressure in the eye, we need to lower pressure in the eye. Just take these drops to help your eye. We may not be really talking about glaucoma specifically enough for the patient to come away understanding that they have a serious chronic condition. You have an eye disease called glaucoma. You have glaucoma, and it does not go away. It is a chronic condition that requires chronic monitoring. Oftentimes, we need to be very straightforward with the patient so they understand that they have a diagnosis and not just some type of symptom that doesn't have a long-term effect or long-term problem. In educating patients, it's also important to use pictures in your dialogue to help them understand. Use certain analogies that can be simplified to things that they can relate with to help them understand what's going on in glaucoma, so that they can feel educated and be an advocate for themselves to take action on trying to help preserve their sight. One great resource for education is the Glaucoma Research Foundation that provides a lot of information for free for patients. I also have a book that's coming out soon called the Glaucoma Guidebook, Learn the Risks and Save Your Sight. In this book, I break down in very simple terms what glaucoma is, what glaucoma looks like, and help people so that they can understand their disease. In addition, I give my top 12 pearls of advice that I wish every glaucoma patient could know in order to take better charge and control of their disease. That book will be available soon. Step number 5 is providing solutions to problems. There are several different areas that can be addressed to help the patient comply better. One has to do with cost. We know that cost can be a very big issue to be able to keep up with medications. So any resources that could be used, whether patient assistance programs or giving samples out to patients, these things are going to be helpful to them to be able to help them keep up with their medication. Even just acknowledging that if there is difficulty paying for the medication, that you can come up with an alternative that they can still continue on a regular basis. Allowing them to know these things can help. Simplifying the regimen is also very important in order to help people comply. The simpler the regimen, the easier it is to take, and that might mean cutting back on drops to combining drops, such as using combination therapy, or even maybe utilizing some other methods like SLT laser or MIGS procedures in order to help reduce the amount of medication that they have. Another area of solution is finding help to treat the dry eye. It is very common for chronic glaucoma drops to either exacerbate or create dry eye disease that can often be a reason why patients don't take their medications. And so working towards treating dry eye disease, whether by using preservative-free drops or BAK-free drops, or utilizing dry eye treatments such as artificial tears or prescription medications or lid scrubs or procedures to enhance meibomian gland function. These are all things that can help to create a better environment for the patient's eye so they can tolerate their medications better and keep up with them. Another area of reduction of medication load is to consider using newer agents like Durysta, which is an injection of sustained-release bimatoprost. This allows for less preservative on the surface of the eye and also reducing of reminding them to take the medication, which can aid in simplifying the patient's regimen while still maintaining efficacious pressure control. Overall, we know that adherence with medication is a problem for these patients, and there are a number of methods that can be utilized either singly or in combination to help improve each individual's patient's compliance with these medications. I challenge you to take one or more of these strategies and implement them in the next week with your glaucoma patients and see how you can help them improve their compliance while also helping them preserve their sight. Before I leave you, I wanted to give you access to this, a free PDF guide called 3 Key Points of Advice to Prevent Blindness, what every glaucoma patient should know. This guide shares some of my best pearls of advice for patients and is available as a free download in the description box below. The exciting news is that I've created a sister channel called iGlaucoma Patient. I created this channel to share easy to understand information about glaucoma, highlighting new innovations and treatments, and to inspire glaucoma patients and those at risk to take charge, learn, and save their sight. Make sure you grab the free guide, 3 Key Points of Advice for your patients, in the link in the description box below, and check out my new channel. Okay, did you follow with me the whole way? Awesome. What was your favorite takeaway that you think you might implement in the next week? Do you have a great strategy that I didn't mention that you'd like to share? Tell me in the comments below. Give me a thumbs up and share this MIGS Meds University video with a colleague if you liked it and think that someone else can benefit from the video, the guide, or both. Thanks for watching the iGlaucoma YouTube channel, a place where glaucoma innovation is made easy for eye care professionals.